Breaking a bone is never fun, especially when you're older. There are 1.5 million fractures in the U.S. every year due to osteoporosis. The loss of bone density is more common in women who have a greater incidence of osteoporosis than stroke, heart attack, or breast cancer combined. NBC5's Lauren Petty explains what you can do now to help.
Donna Omar and her husband Leonard just got back from a European river cruise.
It has been canceled 3 times because of COVID. And I was determined, I'm going on this cruise.
The 75-year-old was able to go despite breaking her femur during a fall from a step stool 5 months earlier.
Once I fell, the impact, I knew I was in trouble.
Donna has already had both knees and both hips replaced due to arthritis. This break was because of osteoporosis, which is a loss of bone density.
It becomes weaker structurally, and that's why it predisposes people to a risk of fracture when they fall.
The data is significant. 1 in 2 women and up to 1 in 4 men will break a bone in their lifetime due to osteoporosis. While genetics play a role, orthopedic surgeon Dr. Omar Behery says there are steps you can take now to help. Eat a balanced diet with adequate amounts of calcium and vitamin D, limit alcohol, and avoid smoking.
In addition to all that, obviously, physical activity. It's very important to stay active throughout your life in terms of, mainly weight-bearing activities.
Osteoporosis is detected through a bone density scan, and postmenopausal women and men with endocrine disorders should talk to their primary care doctor about getting screened. Donna had been diligent about hers, the osteoporosis diagnosis coming just a couple months before she broke her leg.
You always think to yourself, that's not going to happen to me. But it did.
Dr. Behery says that's why fall prevention is also key. Yet he treats patients with fractures like Donna's nearly every week.
Not everybody's lucky to have done so well. I mean, this is marvelous. It's exactly why I love waking up every day and coming to work.
At Midwest Orthopedics at Rush, Lauren Petty, NBC5 News.